All right, welcome, scribes. I just want to walk through one section of ED orders that I'm hoping that all of us as scribes can start to use and remind physicians that it's here. So I want to go to ED orders. I know some of the groups don't use this as much, but I really hope that we all can start to incorporate this, and not necessarily for the MDM section, which is what the physicians will typically do in ED orders, but for procedures and for this opioid use disorder section. So I want to walk through this with you in this brief, like 5-minute video. First, to review, go to edorders.com, click the login button, and for scribes, it's going to be this button that you'll use. On the right, in this gray box, it says Login Non-CarePoint. Click on that. Your username will be cpscribe, and then the password is the same, cpscribe. So you'll type in username and password cpscribe. It's standard generic for all scribes, and then click Login. Now, for this video, we're going to be discussing this opioid use disorder hub. There's a flag for it here on the left, and the way to get it is to click here on the top. A little bit to the right, it says Opioid Use Disorder Hub. So click on this button, and this will give you some information about opioid use disorder and a video that the providers hopefully will watch at some point or have watched from CarePoint. This is about a 15-minute video. I would encourage, if you have an extra 15 minutes on your shift, to play this, and so that you can familiarize yourself with this treatment so that you can document it appropriately. You can do this at home easily as well. And then note on the right side, this is where the resources that can be printed up as discharge instructions for anybody who has a substance use disorder. This means opioid use disorder and alcohol use disorder, for the purposes of this discussion primarily, but also any substance abuse disorder can benefit from receiving home discharge instructions that are outlined here. So familiarize yourself with this list and where you are. So for example, I work at Utah County in Utah. I'll use this link, click on it, and this is just printable. You can copy it and paste it on a Microsoft file or your Notepad file or any file that is printable on your computer. So copy, click this button, and then paste onto an application that allows you to print. Sometimes you can print directly from the browser. So that I would like for scribes to do anytime you put in a discharge instruction that includes opioid use disorder. Now, the other thing that you can do is encourage a provider to use this Bicycle Health Referral, which is an online outpatient substance abuse disorder treatment where they can get telehealth services at home for addiction, including alcohol and substance use. This is something that the physician can walk through, and you can learn and walk through as well, to arrange that just by filling out a couple of sections that have patient information if the physician asks to have the patient referred. All right, the next thing is to go to step number 4, document medication-assisted treatment for opioid use disorder. And this is where you'll be doing documentation whenever a physician works on documenting buprenorphine use. This is a billable procedure that I would encourage the scribes to remind providers is here. CarePoint has asked us to be a go-to for encouraging the use of this tool. So people with opioid use disorders who are in any sort of withdrawal, this is a great treatment for them that's evidence-based and effective. And physicians, as they start to use it more, will ask you to document this. So just the best way for scribes to familiarize yourselves with this is to click these clickable buttons and see what goes into the chart on the right. And then you just copy it and you paste it in a blank MDM section on Meditech if you're using Meditech. So when you click on induction of buprenorphine, this is the button you use. Anyone who has ordered buprenorphine for substance abuse, for opioid addiction and withdrawal. And you click this, it says screening, brief intervention, referral to treatment. Again, referral to treatment, as we showed, you can print off for discharge instructions. This is all self-explanatory. The time spent, in discussion with the patient and treatment and counseling. So that includes all parts of care for patients with substance abuse disorder, for opioid use. And then you can see indications. This is just information. Opioid withdrawal and treatment of opioid use disorder is the indication. Discussed possible harms, substance abuse disorder, or alcohol use disorder. So this can be a way to document in alcohol use disorder treatment as well. Patient is screened for opioid withdrawal and opioid use disorder. Use that button appropriately. COWS is how we essentially grade severity of withdrawal, and you can look that up in Google. It gives you some information. It's basically a point system that tells you whether they're in mild, moderate, or moderately severe withdrawal based on their clinical presentation. So that's the COWS score is greater than 8. They deny recent use of opioid because they're withdrawing, and then they're found to meet criteria for substance use disorder or alcohol use disorder, depending on what we're doing here. Risks and benefits discussed, and then given buprenorphine, 18 or 16 milligrams. Again, I would like for scribes, whenever the physician is involved with a substance use disorder treatment for patients, to ask if you can fill out this procedure note for them for that. And then after the treatment of buprenorphine, or a benzodiazepine for alcohol use disorder, or a phenobarbital for alcohol use disorder. So any of these used in these disorders. And then after reevaluation, are they improved? Was there no complications? Were they referred? This is a way to provide compensation for physicians for doing these services. So it will be an important adjunct in scribing for you to include this on your physician's documentation. And I would like for you all to work on making the physicians aware that this documentation is available. And then this is the referral. So the Bicycle, as we said, the online tool for outpatient treatment, or the local clinic, as we showed you initially, the printout for your local area for any clinics that can be contacted for the patient. So that's it for today's video. Hope you learned something. Let me know if you have questions. Text or email me. Thanks.